As the next presenter, we have Dr. Ruchir Mehra, who heads Remedo. So over to you, Dr. Ruchir. Would love for you to take over from here.
Hi.
Hi.
Sorry, I'll just do a screen share quickly. Hey, can you see this?
Yes, doctor. You want to go into presentation mode if that works, but we do see the adult screen for sure. Yeah.
No, I think there's some problem. Sorry, it just gets paused.
No, totally.
It's okay. I'll leave it here.
You can go forward. Yeah.
Sorry. So I'll try to keep time. So we are a little different. So, with respect to our key offering. So my name is Dr. Ruchir Mehra. I am an MBBS from Maulana Azad Medical College. Did my MBA from IIM Lucknow. Worked in Accenture Consulting for 4 years. And then for 5 years, I was in Fortis Healthcare, the hospital chain. After which I quit to start Remedo along with 2 other founders. Our vision really is to help doctors provide better care to patients using technology. Especially in a world that is fast changing with respect to the patient really changing, especially in the last 2 years, we've seen that. The fact that patients are coming online. Everybody has a supercomputer with high-speed internet in their pocket. And doctors know that, I need to improve my online presence. But today I'm probably dependent on aggregators like Practo, or of course, agencies that help me with the website or with SEO, etc. In fact, our research shows that 75% doctors actually don't even have a Google business page. So what Remedo does is kind of what has happened and played out in other industries. That is what a large company like Shopify has done, which is the opposite of what, say, an Amazon does, or what a DotPay has done, which is the opposite of what Zomato and Swiggy do, which is helping doctors build their own online presence as opposed to being dependent on aggregators. So what we actually do is we help doctors with their independent online presence where they can build their own brand online. We do this through by connecting with the doctor's Google business page. We are a Google partner and part of the Google Accelerator program, so we have access to their APIs. So we optimize the profile. We create a website which is a personal website for the doctor where I can post blogs and patients can read about me and actually reach out and book an appointment. We also have an AI-powered chatbot which understands patient intent and helps answer patient queries. So if a patient is messaging me at 10 o'clock in the night, or say if I'm in a procedure, it will help me answer those queries and actually convert queries into appointments if the patient wants that. This chatbot incidentally won Google's award last year. The only healthcare company globally that won. So think of it as my independent online presence. Now this syncs with the Remedo app, which obviously provide me tools to manage and engage patients. And patient management, of course, is about things like telemedicine or medical records and appointment billing, etc. But for us, the key piece really has been care plans so that I can engage my patient, care plans for chronic, semi-chronic conditions, or to put it differently, it's a doctor-driven digital therapeutic. That is, how do I stay connected with my patient? Because as a doctor, I get limited time with the patient. How do I influence sustainable lifestyle modification in the 8-10 minutes that I'm going to get today, and then 8-10 minutes that I'm going to get after a month? So that is, and I'll just talk about that in the next few slides. The third piece is more about converting patient engagement into online reputation management. So, doctors typically face a particular problem that, we're not like an Uber driver that we'll say, please give me a 5-star rating, right? But at the same time, what a past patient has written is very important for a new patient to really read and understand about. So Remedo converts patient engagement, patient satisfaction into online reputation management using WhatsApp as a tool. That is, how do we nudge a happy patient to actually leave a review? Because the typical problem with doctors is that the patient who's unhappy goes online and leaves reviews, and those who are happy don't. But right now, I'll just focus the rest of these slides on really the engagement piece, which is focused on care plans. Here, our vision really is a little bit like what Dr. Akanksha highlighted on being a combination of medical and wellness aspects of care. That is not to create a parallel B2C product, but really augment what the doctor is doing, so that because as a doctor, I want to provide better counseling to my patient, but I know that I can't influence their day-to-day behavior change. So that's really where Remedo's product comes in the engagement piece. That is, I can put a patient on a care plan, and then the patient will receive videos, images in English, Hindi, so that they understand their condition. They make changes to their lifestyle, exercise, diet. They get reminded about the medicines I may have prescribed. They can track the relevant health parameters, share it back, with me. And most of this is really done through WhatsApp, actually. So because we believe WhatsApp is universal. The patient is always on WhatsApp. So a lot of the content, a lot of the actions that we ask them to do for sustainable lifestyle changes, or we even have health coaches who are like dietitians, etc., who can answer a few basic questions, all happening over WhatsApp. Similarly, patient, how do we improve compliance to what the doctor had prescribed? Also done through WhatsApp, so that they get reminded about their medicine intake, etc. And in fact, straight away from WhatsApp, they can book a repeat appointment for me. The third thing we are rolling out right now is really a community, again over WhatsApp. Think of it like support groups, so that patients can interact with other patients who have the similar condition. So that's pretty much the product and the value offering for doctors. Today, we are focused on women's health, especially PCOS, infertility, endometriosis, and of course pregnancy, which are chronic, semi-chronic conditions in women's health. But we are right now working on obviously the more common chronic conditions, which is hypertension, diabetes, obesity, or osteoarthritis, etc. Really, the vision for us is how do in the next 3-4 years, doctor practices are going to use technology a lot more than they have used, say, 3-4 years back. And our vision is that doctors who provide better care to their patients also see a growth in their own practice. That's actually what really Remedo is about, and that's what we're doing. There are about 6,000 using doctors across India on Remedo, and yeah, that's a little bit about us. I hope I made time, Tushar.
Yeah, absolutely well within. So thank you again for that, Dr. Ruchir. Would love to see if the panel and faculty members would have any questions.
Dr. Ruchir, a small query here. So when you have 6,000 patients, doctors on board who are using all this for you, so you expect all of our patients to download this app?
No, it's deliberately, Dr. Amit, mostly done over WhatsApp, because typically, what we've seen is, so there are actually two types of patients, right? One, those who are on the care plan, and those who are not. Those who are, just generally interacting with me may not necessarily have a chronic condition as such. So, we don't expect those non-care plan patients to ever download an app. Frank, why would I download an app? The patients who are on care plan, while a lot of the care plan is delivered over WhatsApp, some of it, for the best experience, we do hope that they also download the app. So it's a little bit of a hybrid approach.
Thank you for the wonderful presentation.
Thank you.